Prescription drug abuse. It is a growing problem in America. Roughly 20% of Americans have used prescription drugs for non-medical use, according to the National Institutes of Health. There has also been a sharp rise in emergency room visits for drug-related suicide attempts. Dr. Gregory A. Smith is a leading addiction specialist. He's with us now. Thanks, Dr. Smith, for coming back. I have this really troubling report here. It says that now 55% increase, that there's been a 55% increase in emergency room visits for drug-related suicide attempts. Now, how do you determine that a drug overdose or too much partying is an attempted suicide?
It's a fine line. I mean, there's so many people right now that are taking these medications for fun. So sometimes when people come to the emergency room, you don't know if they were taking it with alcohol at a party or truly trying to kill themselves. But if you look at it, if somebody has 2 or 3, say, Xanax or 2 or 3 Vicodin and some alcohol in their system versus 50, 60 pills, you know there's a good chance they weren't trying to kill themselves.
Right, that does make sense. So what do you do with maybe the folks in the middle, where the 2 Xanax is just not doing it for them anymore, so now they're up to 4 or 5?
Well, see, this is why there are so many people dying right now. It's not even like they're trying to hurt themselves, but it's the combination of sleeping pills, anxiety pills, Vicodin or other painkillers. They take it all together, and it's like this horrific chili in your bloodstream, and all these things mixing together, and people go to sleep sometimes and they just don't wake up.
That's just so horrifying, isn't it?
It's a bad situation.
When we were looking at the statistics, it seems that the worst increase here is 155% among young men ages 21 to 34.
Yeah, it's really affecting younger people, and the numbers are similar in adolescents, 13 to 17 years old, and it's really a bad problem. We are in difficult times right now. It's a bad economy. There's a lot of pressure financially, especially on men who are often the breadwinners. So there's a higher instance that people are on antidepressants. There's a higher instance that they're on anxiety pills. Combine this with a little alcohol, with a little narcotic, and again, people take these things and they just don't wake up.
So clearly it's a very serious problem, but on the statistics as far as attempted suicides,
right,
do you see that group is also increasing? I mean, that's what this study says, yes. But what troubles me about the statistics of attempted suicide is what's happening that many people are trying to kill themselves.
Well, again, it is accurate because, again, anytime there's bad economic times, there is a higher incidence of suicide. And then when you have this epidemic of prescription pills that people are on, it's like a perfect storm. You have people that have all these medications in their medication cabinets. It's like a loaded gun. So they have the tool to hurt themselves. They're depressed. They're sad. The two mixed together, you have a higher incidence of suicide attempt.
So what do we do about this? I mean, you're the doctor, you're the person who's trying to hold them and their family together because it's a family problem. You can't just fix this yourself. So what is it, of all the discussion that you hear and all the chatter and everything that you hear every day about this topic, what is like the 1 or 2 things that drive you crazy that are just so off target from your perspective?
Well, first, people don't recognize that people are having a problem. You see someone that's laying in bed for all day. They're sad, they're crying more. People sort of think that they'll get over it. And often the first time you find out a person is really, really depressed is when they've already killed themselves. So we don't want to wait to that point. So the thing that I always tell people is we cannot control what happens to us, but we can always control the way that we react to what happens to us. And we, as a society, are making bad choices of how we deal with it, using drugs, alcohol, instead of using things like meditation, relaxation techniques, and physical exercise instead of drugs all the time.
All right. Dr. Smith, always a pleasure.
Thank you.
Thank you.
Thank you very much.
The voice of reason in all of this, always.